Κυρίες και κύριοι συνάδελφοι, καλησπέρα και από μένα. Θα ήθελα να ευχαριστήσω πάρα πολύ τους σημερινούς ομιλητές, όχι μόνο για τις εξαιρετικές τους ομιλίες, αλλά για το ότι επίσης στήρισαν τον χρόνο τους. Είμαστε ακριβώς στο χρόνο μας. Θα ήθελα να σας ενημερώσω επίσης, όπως με ενημέρωσαν από το γραφείο, ότι τώρα που μιλάμε έχουμε πάνω από 1.000 εγγεγραμμένους, 1.100 τόσους εγγεγραμμένους για παρακολούθηση του συνεδρίου μας και την πρωινή session την παρακολούθησαν πάνω από 600 άτομα. Σας ευχαριστούμε πάρα πολύ για το ενδιαφέρον σας για τα θέματα που άπτονται της παιδιατρικής γαστρεντερολογίας, της πατολογίας και διατροφής. Τώρα ακολουθεί μια δορυφορική διάλεξη που είναι ευγενική χορηγία της εταιρείας Cube Pharma and Nutrition. Ο τίτλος είναι reuteri, Lactobacillus reuteri, and the synergistic role of vitamin D in immunity. Η διάλεξη θα δοθεί από τον καθηγητή D Peroni, ο οποίος είναι Professor of Pediatrics στο Πανεπιστήμιο της Πίζα, στην Ιταλία. He's director of the Residency School of Pediatrics at the same university, Pisa University. He graduated at the University of Verona, Italy, and frequented for 18 months the immunopharmacology group at the University of Southampton in the UK, directed by Professor Stephen Hall-Yates. Professor Peroni is the author of more than 300 publications in international journals with impact factor. He is also the author of several scientific communications to international and national scientific meetings. Professor Peroni, his main interests are in allergy, immunology, and pulmonology in pediatrics. Ο καθηγητής ο κ. Περόνι θα είναι μαζί μας, θα συνδεθεί σε λίγο μαζί μας. Η ομιλία του είναι pre-recorded, για να μην έχουμε πρόβλημα σύνδεση σήμερα. Οπότε περνάμε στην ομιλία του και μετά θα έχουμε τη χαρά να συζητήσουμε το θέμα μαζί του ζωντανά.
Good morning. It's a real honor and pleasure to be invited by your society and to be present in this Congress. So the matter of my presentation will be immunity, vitamin D, and synergy with probiotics and Lactobacillus reuteri, DSM 17938 in particular. I have articulated my presentation with questions and answers. So the first question is why vitamin D is a key actor in the immunosystem. And the answer that we can have is that we have a lot of indication that vitamin D receptors are present in the organism in several apparatus and on several cells, and in particular on immunocells. So vitamin D is a crucial, probably signals to have a sort of presentation and signals and action on immunosystem. We well know that vitamin D derives from sunlight exposure, and we have also dietary source of vitamin D. Anyway, again, regarding the immunosystem interrelationship with vitamin D and immunosystem, we know that vitamin D could interrelate with the innate immunosystem as well with adaptive immunodefense. So we have indication from the literature that probably the early exposure of even during pregnancy to vitamin D could be a risk factor to develop non-communicable disease. In these French studies, the author have underlined as the level of vitamin D in cord serum were inversely correlated with the probability to develop atopic dermatitis by age of 5 years. In other words, the less the level of vitamin D during pregnancy or at the cord blood, the more pronounced risk to have the atopic dermatitis at 5 years of age. And this is another experience from US, and the level again of vitamin D, in this case also with vitamin A, were related to a worse course of infection, of lower respiratory tract infection. In fact, the patient who has hypovitaminosis D and hypovitaminosis A have more probably access to ICU admission and mechanical ventilation. In other words, the lower level of vitamin D, in this case, in the subject, the more risk for intubation and intensive care unit admission. And another experience that is quite interesting is this one. And this author have shown again that if infants, children have severe pneumonia, but have at the same time hypovitaminosis D, the resolution of the pathology of the disease is particularly controversial, and the patient is not answering to the normal level of therapy. So the other question is, of course, if there is any correct serum level concentration for vitamin D, which could prevent diseases. And is, again, quite controversial. But we know from the literature, from the American literature, that, such as in this case, if the children with asthma have low level of vitamin D, you can see if they are deficient with the value less than 20 nanogram per ml, they have more probability to have an uncontrolled disease. And so you can see that the patient with the lower level of vitamin D, they have more total IgE and eosinophil count. They have an increased risk for hospitalization in the previous year. They use more anti-inflammatory medication. They have an increased airway responsiveness. In other words, an uncontrolled asthma. And there is also another indication from the literature, as this one, from US again, where this author measured vitamin D during several periods in the first 10 years of life of these children. And again, they were able to show that several episodes of hypervitaminosis during the first 10 years of life are more related to have more allergic sensitization, to have a more allergy-related airways inflammation, to have, in other words, more asthma and more uncontrolled asthma. And so the editorial accompanying these papers show that probably in the puzzle of asthma inception, also vitamin D could be relevant. Because probably is working on infection, is working on immunosystem, is working in some ways that could help to develop asthma. And to answer to the question of this chapter, we know that vitamin D levels are optimal for the muscles and bone health. But probably the level that we are going to consider to be the very healthy level for the immunosystem should be higher than that one we consider for the bone health. In other words, you can see that if we want to reach an effect on immunosystem, we have to consider the level a bit higher, 30, 40 nanograms ml of vitamin D in the serum of this subject, more than that we will require for the bone health. So this is a major point, considering that worldwide we have a sort of epidemics of hypovitaminosis D at all ages during the life. So another question is this one. How do we need to manage vitamin D supplementation? And when is a good biological window for intervention? Pregnancy, pediatric age, perinatal, or adult age? And we have no answer for this, of course, but even for other vitamins or oligoelements, we have to consider that the life during pregnancy is particularly important. And this study is particularly important in my mind since they enroll a lot of healthy pregnant women. They measure maternal vitamin D intake at 32 weeks of gestational age, and they shown that in the lowest quintiles of vitamin D, in the highest, quintiles of vitamin D intake, the odds ratio to develop even within the previous years, persistent wheezing in the children, when the children will be 5 years old of age, is much lower than in the children born from the mothers who have the lowest quintiles of vitamin D intake. In other words, if the mother have a great intake of vitamin D during the pregnancy, this is better for to protect, in some words, from wheezing the child during the first years of life. And this is the same story is quite is coming from this other trial that this data style, they gave to pregnant women supplementation of vitamin D that was quite abundant, and they shown the result at 3 years of age and at 6 years of age in the offsprings in terms of incidence of recurrent wheezing or asthma. And the level is, the results are quite interesting, because you see that in active group, when they gave this very strong supplementation respect to the control, they have a quite positive result. It was not significant, but it was very, very there to prevent the wheezing at 3 years of age. Different result was obtained when they consider the wheezing or asthma indication at 6 years of age. But we know that asthma at 6 years of age probably is a different story. There are so many other confounding factors that could be related to the natural story of the disease. And the vitamin D probably is just a part of the puzzle, as is not so important. But vitamin D could be relevant at the first 3 years of life, since they shown an almost significant effect of vitamin D supplementation. So we have also to consider that vitamin D could be relevant even to prevent acute respiratory tract infection. In this systematic review and meta-analysis, Martineau put together a lot of papers coming from the literature involving children, involving also adults. And as you can see, the results are a bit in favor of the vitamin D supplementation, even though they are quite controversial. But there is a point that is particularly interesting, that the more beneficial results were obtained when the children or when the patient received daily or weekly vitamin D without an additional bolus doses. And the other effect is that the effect in terms of prevention of acute respiratory tract infections in this group was strongest in the patient with the more profound vitamin D deficiency at baseline. So we have to consider which are really the patient at high risk to have hypervitaminosis, because supplementation in these patients will be probably more effective and more protective. So again, the literature say that probably daily doses of vitamin D supplementation are much better than the bolus doses, since this author shown in this meta-analysis the odds ratio for respiratory tract infection was particularly significantly reduced if the doses were daily administered. But we have a sort of indication from the literature or from guidelines such as this one, and we have to consider, this is my suggestion, if you want, this is a consensus from Italian Pediatric Society on vitamin D. And we have to be anchored, I would say, on the risk factor, the dosage, when, the timing, on what the guidelines are suggesting. And this is experience from Belgian colleagues, and they have shown quite interesting, coming back to the dosage of vitamin D, of what make really the difference in the level of vitamin D. And you can see that there is the food, there are mandatorily fortified food, voluntary fortified food, but the difference is done by supplementation in brown. So you can see that, particularly in the first years of life, but we say in all the childhood, the supplementation is the make really the difference. You can see on extreme right that also pregnant women, lactating women are, when supplemented, they receive the right intake of vitamin D. And so, coming to the title, immunity, vitamin D and synergy with Lactobacillus reuteri, the question is a probiotic and vitamin D combination a good idea? If I have data supporting the synergistic effect. And this is a good point, since we know that both probiotics, lactobacillus from one side, vitamin D, are involved in connection with the immunosystem. Lactobacillus were found to bind the toll-like receptors. They are able to talk with the monocytic derived dendritic cells and induce tolerance. They drive the development of T regulatory cells. And again, vitamin D interacts with innate and adaptive immune system. And this is an ancillary study coming from Italy, where children with allergic asthma were treated with the combination of Lactobacillus reuteri plus vitamin D. And they have, evaluation after 3 months, and then in the follow-up of exhaled nitric oxide, which is a marker in terms of inflammation in the airways, in the lungs. And this is quite interesting because they started at the beginning at the same level, quite high, because they were inflamed, having allergic asthma. And you can see that in the group A, which received active treatment with the combination of reuteri plus vitamin D, there was a significant decrease in the level of exhaled nitric oxide, which was maintained then during along the study and during the follow-up. This is quite important, since we can have an indication that the combination of the treatment can interact really with the immunosystem and drive in some way the immunological response. And the rationale for the combination of probiotic and vitamin D is that both are able in the gut to increase, to strengthen the defenses in similar way. enhancing tight junction between intestinal cells, stimulating the production of antimicrobial peptides, modulating the gut immunocells. And Lux has both bacteria, microbiota from one side, and vitamin D are really interrelated, since low levels of vitamin D and decreased activation of the receptor of the vitamin D in the gut cells results in less beneficial species of microbiota. And from the other side, the receptor, the activation of vitamin D receptor enhancer is effective in the presence of beneficial bacteria, such as lactobacillus, of course. So another question is how important is strain specificity for a probiotic plus vitamin D combination. So we have to consider that probiotics are not the same. So the strain is absolutely important. And we have to be anchored, I will say, to the demonstration of activity which are present in the literature. So you see at the top of the level that the rare effects are strain specific. And we have to consider this when we talk to say regarding Lactobacillus reuteri and infection protection. This is one of the first demonstrations from Weizmann that in red, the administration of reuteri was able to reduce the number of days per child of fever, diarrhea, and probably also respiratory illnesses, even though this was not significant. But anyway, with this another experience where Gutierrez Castrillon was able to administer reuteri versus placebo in a lot of these children, preschoolers. And the first outcome, the primary outcome was to reduce the days of diarrhea. And, you know, this was the study, placebo versus reuteri, Protectis. And they were able to show that not only there was less episodes of diarrhea, but there were more days without respiratory infection in the children treated in yellow with the Lactobacillus reuteri versus placebo. And this was particularly significant. And these data are significant, and then the same author in the very recent paper shown that the probiotics could really prevent or reduce the risk for respiratory infection in healthy children. And they were able to show that this effect was really strain specific. In other words, you see here that the strains are really indicated. These are the strains which were utilized in papers where the reduction was really effective. But coming back to the combination, because the combination could give a supplemented positive effect. So I will suggest that Lactobacillus reuteri DSM 17938, the strain that is particularly effective, and the vitamin D and vitamin D supplementation may act in a synergistic way. When? In infancy. This is very important for the pediatrician, of course, because the prevention is so important. And in infancy, we have the maturation of the immune system. And then in infancy and early childhood, to prevent the incipit, the onset of allergic disease. And again, during infancy and childhood, in the prevention of upper respiratory infection. And so I would like to end my talk with these cartoons, which represent the mechanism. So we have to consider when we have to administer probiotics, vitamin D, the combination, that the mechanism are quite clear and could act really on the immune system. And the final slide is to thank you for your attention and for your wonderful country where I spent 1 week that was absolutely fantastic the last summer. Thank you so much for your attention.
Professor Peroni, thank you very much for joining us today. Thank you very much for this exciting talk. It is a very interesting concept to combine two preparations, two agents with different immunomodulating effects. However, I have some questions. How do you choose the dose, the appropriate dose for the appropriate group of patients?
Thank you. Thank you very much, Professor Papadopoulos. Thank you very much, and it's an honor to be invited to this fantastic meeting. And coming to your question, I would say that for every strain, we have a peculiar dosage, which is established from the early beginning when the strain is tested on animals and then on humans. So for every strain, we have to consider that the right dose is just one. So the concept that the more the best is not for probiotics. So we have to consider that giving the probiotics every day and as a supplementation, we have to remain in the dosage which are established for that particular strain.
Thank you very much. However, I did not mean the dose of probiotic strain. I had in mind the dose of vitamin D.
Yeah. Excuse me. You're right. And regarding vitamin D, we have to be, again, to consider which are the indications from the guidelines, national or international guidelines. In other words, if the child, the adolescent is healthy, a supplementation of around 800, 1,000 units per day is enough. If we have, in the case where we know that there are insufficient levels, more amount is indicated, and we can also think about 2,000 units of vitamin D supplementation. And but again, I will suggest to see which are the indications present in the plants, and they are quite clear. But around 600 or 800 units per day, the right amount for prevention.
Okay. I see there are no questions from the audience. May I ask you, how do you... Yes, there is one question, but it is answered. It was regarding, again, the dose of vitamin D. So this is answered. I would like to ask you, how would you suggest to select the appropriate patient groups for this preparation combination?
Thank you. This is a very, very important and crucial point. Since we know that the infants are okay for the supplementation of vitamin D, at least in Italy, but I think also in Greece, I think that this supplementation is particularly indicated for the children more than 1 year of life until the 5th year of life, since in the preschoolers infections are particularly relevant, and so the risks are the major. So we have more space for improvement given this combined supplementation. Another point that is particularly peculiar is the adolescent, since we know that the risk factor during this period of life for hypovitaminosis are quite common. They are studying a lot, hopefully, but however, they stay a lot at home in Italy and also in Greece during the winter and during the summer. So this is a major point, and I would say that also supplementation in adolescent is particularly relevant. Of course, this supplementation, these ages are indicated in healthy status, where we have a sort of to think about prevention, where infection, recurrent infection of the respiratory tract could be a problem. But if we have a chronic disease such as asthma or something more, we have to consider that every age is indicated for supplementation.
Are there any studies on prevention, let's say, of food allergy? We know, for example, children that are born with cesarean section have a therapy risk to develop food allergy or asthma or conjunctivitis or whatever. Are you aware of any studies study the prevention effect of the combination?
Yes, this is a major point since prevention effect is the main goal for every pediatrician. And the matter is quite controversial since you have seen that there is this paper coming from US where they gave to the mothers during pregnancy a lot of vitamin D. And they were almost able to demonstrate that at 3 years of life, the wheezing effect was reduced, but no effect on asthma at 6 years. So even in food allergy, as you mentioned, the data are not clear at the moment. We say that they are negative than positive, but we have to consider the individual effect within these studies. In other words, if I will have to think for a patient in terms of prevention, and if this patient is in high risk given by family and from heritage, I will suggest to try to give this combination, because both systems, probiotics and vitamin D, are working on Immunosystem, and we have a demonstration that immunological mechanisms are really working. So I will try to give a period with this supplementation, even for prevention.
There is a comment, more as a comment, from a colleague, saying that there is a risk of hypervitaminosis in neonates under supplementation. What are your views?
Yes, this is quite interesting. So neonates the level of vitamin D in neonates are very related to the levels of the mothers. So in other words, we know how much vitamin D is important in the late phase of pregnancy. Anyway, we have to consider that hypervitaminosis D is relevant. And for this reason, we have indication from the literature that supplementation is absolutely necessary in the first 5 phases of life, I would say in the first year. And we have indication from Britain that the rickets are coming back. So where in England, supplementation is suggested but not mandatory. So we have to keep in mind that we can have hypervitaminosis for different things. And I will not recommend to measure to the mother or to the infant the vitamin D level, but just to give the supplementation that is the important things that we have to do. In case of chronic disease such as difficult eczema or something like that, the levels of vitamin D in the infants are particularly low. And so again, we have to consider the situation of the mother and of the infant, their lesion risk, the not exposure to the sun, the diet, and other things.
There is another question asking what is the most appropriate time of the day to give the combination one, and second is for how long it can be given to a healthy child.
I have no really idea which is the time more appropriate for administration. But anyway, I will suggest that probably it will be recommended a bit far away from the main courses, if just because absorption of the both supplemented factors are probably more indicated. And the other part is for long. For long, this is very important because if you want to save an effect, an immunological effect, we have to consider that the level in the serum should be particularly higher than those who are related to the bone increase and bone development. In other words, we have indication from the guidelines that supplement. We have a different patient probably for prevention, particularly for the infancy. The infants, I will suggest the first years, of course, and then during winter time, particularly from November to March. But there are also indications in Italy and even in Sicily, just to say that hypovitaminosis D is possible even during the summer, because the lifestyle of our children is completely changed in respect that was some years, some decades ago. So probably I will suggest to give the supplementation for a longer period.
Are you aware of any other studies on other probiotics in combination with vitamin D?
There are not so many studies. We are running now a trial in Italy for the combination of reuteri plus vitamin D to reduce the upper respiratory tract recurrent infections. Unfortunately, during this COVID era, pandemic, even this trial is stopped, so we cannot produce results. Anyway, on the literature, there are not so many indications of this prevention. So this is a crucial point in my mind, and I think that putting together the data coming from vitamin D supplementation from one side and probiotics and reuteri from the other, I can imagine and suggest that the synergy of the two factors could be able to give an added factor in terms of prevention of infection disease.
Thank you very much, Professor Peroni. I don't see any other questions or comments from the audience. So thank you very much for joining us today, for giving us a nice presentation on the new cutting-edge research on early reuteri and vitamin D. Have a nice day. And,
thank you. Thank you so much. It was a real pleasure to be with you, and hope to see you very soon. Thank you so much, Dr. Papadopoulou.
I wish to be able in the future to have a face-to-face meeting and discuss this further. Thank you very much. Thank you.
Thank you. Bye-bye.
Bye-bye.